recognize that pharmaceutical companies today are extremely profitable, but they are the fraction of, we'll call it EBITDA margin, that pharmacy benefit managers do. Remember, the pharmaceutical industry makes the drug. There's costs associated with that. You have ingredients cost, you have research and development cost, you have the cost of getting it to market and production and all of that. And so their margin is much slimmer, although greater because they are the manufacturer in its aggregate, but slimmer on the percentage than the PBM. PBM doesn't make anything. PBM negotiates things. So there's not a lot of overhead cost to the PBM to negotiate the drugs, and they get the highest level of spread. So the profit margin for the PBM is extensive. And unfortunately, over the last number of years, we being America, have made PBMs uber powerful. I write about this in The Cure, that in my opinion, hospital systems and PBMs are the too big to fail now. Although I think that we could get PBMs out of the way, hospital systems not so much. Big conglomerate hospital systems I'm talking about, not more regional hospital systems. But from a PBM perspective, you got to know that they're going to fight hard against this. The pharmaceutical company is going to put their weight behind it too, but the PBMs are going to fight hard to make sure that CMS cannot negotiate the price of drugs. I would love to see it happen, but it probably won't for that very reason. If it did, here's the cause and effect of that. We would see a short-term spike in the cost of the employer market. When you try to reduce the cost of things by federal government involvement, you never reduce the true cost of things. You just squeeze the balloon and the air moves to a different part of the balloon. And just like we saw in the Affordable Care Act, when the federal government got involved in reducing the cost of health insurance, it didn't actually reduce the cost of health insurance. It provided subsidies to reduce the cost of health insurance. And as a result, the cost of health insurance actually went up astronomically. So while I like the idea that Uncle Sam should be able to negotiate the price of drugs, it needs to be done in a way that regulates the amount that the pharmaceutical industry, and by the way, I'm not for price fixing, but you have to understand that you can't solve for one side of this without solving for the other. And the other mean that you need to either set protocols by which pharmaceutical companies lose access to their patents sooner, or you put protocols in place that says that there is some level of cap to the amount over and above Medicare that employers and private pays would have to pay. Or the third thing is that you could create a structure by which pharmaceuticals are required to be completely transparent as to all of their costs. That's the one I'm most in favor of, because transparency leads to consumerism. And the consumer is the greatest mandator of our economic system. So if the consumer can have more information, then we can drive the cost of goods down through